And here are two muscles that are involved with swallowing, just getting my pointer here, that are involved with swallowing and speech. So they're going to be involved with the hyoid bone, which you can see a little bit of here. As we know, the hyoid bone doesn't attach to any other bone of the skeleton, doesn't articulate with any other bone, but it's a base for the tongue. And of course, the tongue is involved in swallowing and speech. So here are two muscles that have some attachment with the hyoid bone. The first is the digastric, which literally means two, and then bellies. Gastric has to do with stomach or belly, in this case two muscle bellies, digastric. And there's one belly of the digastric muscle, and you can see it going through this loop of ligament, right, that's attached to the hyoid bone, and then you have another belly running kind of back this way. So there's your digastric muscle involved with moving that hyoid bone, right, for swallowing and speech. And then deep to the digastric, so on this side the digastric has been removed, so you can see this wider muscle, which is the mylohyoid muscle, right, that goes from the mandible to the hyoid bone, right, also involved in swallowing and speech. So we're getting into the neck now. So these are muscles of the neck, and when the neck moves, or when the neck joints, you can see of the vertebra here, when they're acted on, well, the head is going to move as a result. So there's some major muscles here that help you move your head because they're acting on bending, right, the cervical spine. So first one, we saw this earlier when we were looking at naming muscles, called the sternocleidomastoid, based off its two origins, sterno and cleido for clavicle, and its insertion onto the mastoid process. It's been removed on this side so we can see deeper muscles, but imagine if both of them were acting together, it's going to pull your chin towards your chest, right, and that's called head or neck flexion. So it's the major muscle to flex your head or neck. It also laterally bends or rotates the head or neck, just thinking this, if we just use one of them on one side, that's going to bring or bend the head to one side while sort of rotating it to the opposite side. So yeah, this is the major muscle, the prime mover that moves your head in different directions. The scalene muscles are deep to the sternocleidomastoid, so remove these and we see these, which is actually three muscles in one. You have an anterior scalene, right, a middle scalene, and then a posterior scalene that are synergists that flex and rotate the head as well. Of course, the ribs can raise up because you can see these attachment points. It elevates the ribs as well, but yeah, for our purposes here, yeah, these are your muscles that are involved with head movement. Now we're on the posterior side of the neck and trunk here. So these are muscles of the neck, of the vertebral column, that perform trunk extension. And what trunk extension is imagine with someone with a really good posture, kind of their upright, erect upright posture. That's what trunk extension is kind of holding your spine extended or upright. And the major muscle that does that is the erector spinae group, which literally means a group of muscles to bring your spine upright. It's a group, so it's made up of a lot of muscles, and these are the kind of the three subcategories that you should be able to recognize as belonging to that erector spinal group. Iliocostalis, so think ilio, the ilium. Costalis, well, costo means ribs, and there's the iliocostalis muscles on either side, going from ilium here and then onto the ribs. There's your costalis part of it. Longissimus, well, that's this kind of this middle portion, very long muscles, right? See the word longissimus on either side. And then in the middle, we see these muscles attaching to the spine, right? We call those the spinalis muscles. So all three of these, Il's muscle, we call it. So iliocostalis, longissimus, and spinalis belong to this erector spinae group. All right, next group of muscles will be your breathing muscles. We call these muscles of respiration. And when we respire or when we breathe in, right? That's called inspiration, right? When we breathe out, that's called expiration. So we have muscles that help us with breathing. Now the prime mover of inspiration, this is the muscle that allows us to breathe in, is the diaphragm muscle, which we saw, I believe, in Chapter 1. We talked about the diaphragm muscle that separates the thoracic cavity from the abdominal pelvic cavity. So here we're looking at this big dome-shaped muscle, right, called the diaphragm. This is the ceiling of the abdominal pelvic cavity. So you're kind of looking up, right? The thoracic cavity would be through this wall, which is the diaphragm. So when you breathe in, this diaphragm muscle is contracting. When you breathe out, expiration, this diaphragm muscle is relaxing. So normal expiration, nothing is contracting. It's just the diaphragm relaxing. So breathing in, inspiration is an active process. Muscles are contracting. Expiration is a passive process. The same muscle is now relaxing. So the diaphragm has a synergist. It's called the external intercostals. So intercostal literally means between the ribs. And we see all these little muscles, right, between each rib. And these muscles help elevate the ribs when you're breathing in to kind of increase the volume of the thoracic cavity. So if we look really closely between the ribs and look even closer here, we see these muscles on the outside here. There's some on the inside, but the ones on the outside would be your external intercostals for inspiration, right? It's a synergist, helps the prime mover, the diaphragm, in inspiration. Then we have internal intercostals. So there's your external. If we look deeper, well, you'll have internal intercostals running at a different angle. Well, we said expiration is passive. No muscles are contracting during expiration. But if you force the air out of your lungs, like you're blowing out very hard, sometimes speaking, singing, right? Well, you're forced to, I shouldn't say you're forced, where you will be forcing air out of your lungs. So internal intercostals aren't for expiration, they're for forced expiration. Now there's 4 muscles that make up your abdominal wall, your abs, right? And these are the 4 muscles. We're going to go to the next slide. I'll explain them because we'll have a nice picture of them. But all 4 of them together, instead of learning the action of each of the 4, just kind of combine it all together just to kind of simplify it a little bit. So all 4 of these muscles will laterally flex, that means bend to the side, and rotate the trunk. So just imagine just bringing your trunk to the left, to the right, or rotating it. Yeah, those are the actions of the muscles of the abdominal wall. So let's go through these 4 with a figure or a picture on the next slide. All right, and here we can see all these muscles of the abdominal wall. A lot are cut away, right? So you can see deeper muscles through the cuts. So this is done to add strength to the abdominal wall. So one layer you'll have muscle fibers, the fascicles running in one direction. You look at another layer, they're running in a different direction. Look even deeper, they're running in different directions. So all these layers with fascicles running in different directions is what gives the abdominal wall its strength. So let's start off with the outer layer, right? And you can see we have these muscles coming in at an angle at either side, and oblique means at an angle, and since it's the outer layer of the abdominal wall muscles, they're called the external obliques. So here's a view. We can see the external obliques are the most external of all the muscles. And there's an aponeurosis. I don't know if you remember that from the first muscle we went through. The occipital frontalis had an aponeurosis, which is a big sheet of connective tissue connecting 2 bellies of the muscle together in through here. Right, we move in, right, a little deeper, and we see these muscles that run straight up and down with some tendons inserted in there. So the word for straight is rectus. We're thinking straight superior to inferior. So these are your rectus abdominis muscles, right, which literally means straight muscles in the abdomen. And here they are, right, they're central. They're deeper than the external obliques, but you can see there's some muscles that are deep to it, which we haven't gone through yet. So if we cut through, actually at about the same level, but on the side of the rectus abdominis. Here's the rectus abdominis. If we move laterally, the same depth, we see muscles running at a different angle than the external obliques. These would be the internal obliques, and you can just see a piece of it here. We can't see it here because it's covered. Here we cut away at the external oblique to see the internal oblique. So just running at the opposite angle of the external oblique, and you can see here, there's the rectus abdominis. It's pretty much the same depth. It's not deeper than the rectus abdominis. It's not superficial to it. It's right at that same spot, but laterally, right, on either side. And if we cut through the rectus abdominis and internal oblique and look real deep, we'll see these muscles running horizontally. Right? That would be your transversus abdominis muscle. Transversus meaning horizontal, right? Opposite of rectus. Transversus abdominis, the deepest, we see it here and there, right? The deepest of the four muscles of the abdominal cavity, or of the abdominal region.